So we'll start with what you see here. I hope you can see the whole picture. But the thing is, this is actually how the software looks like. In the beginning, what you'll do here is you have to, either put the new subject inside, or you choose from the list of the subjects that you have already measured. So, not to waste any time, I'll just take one measurement that was generated. I just generated a few minutes ago, in which I kept what I'm measuring here is actually a male who is between 30 and 40, and the reference values will be taken from non-specific sport, so it will be just the average of everything. So we are not into very detailed reference values. So once you put all the data inside, you need to decide which muscles actually will be measured. So for you, probably the easiest to see will be now the leg muscles. I will try to do left and right, a couple of muscles, and then I'll switch him around. And so we can also measure the posterior muscle. So at least we'll get a couple of lateral symmetries and one functional symmetry, so you can see that, how quickly the result comes out and what we will see from the results. For the first muscle that I'll pick, I'll take a little bit longer because I will try to explain how the measurement protocol looks like. I can do just the basic description at this moment. So what I'll do now is I'll start with the vastus medialis muscle on his right leg. So in order to do that, you just ask the subject to contract the muscle. So that means that he will extend his knee completely. What I want to do is I want to keep both electrodes within the muscle belly that I'm trying to measure. So I try not to cross to neighboring muscles, because if I put the electrodes on more than one muscle belly, I will get the response of the multiple muscles, and I want to isolate as much as I can. So that's the first step. The second step is I place the displacement sensor on the muscle. In most cases, positioning is very straightforward. You locate the area in which the muscle belly is the thickest. Usually that's in the center of the muscle belly, not always. For some simple muscles like biceps brachii, it's very simple because it's a nice shaped muscle. For some muscles like lateral head here on the quadriceps, it's a little bit more tricky. But nevertheless, you search for the area where the muscle belly is the thickest. And in most cases, if you're working with athletes, that's quite simple. In other cases, what you have to do, you will have to palpate where the muscle belly is. And also, there are some guidelines. There are some let's say, anatomical guidelines, how to pick the right area on a certain muscle. And it's very, very similar to the area which is used to use the needle electrodes when they do the EMG readings. So this is the second part that you do. So position the electrodes, position the sensor, and you're ready to do the measurement. So what I want to get is I want to get the maximum response from the muscle, and I don't know if that will be at 20 milliamperes or at 80. So the stimulator can reach up to 100 milliamperes. This is in most cases more than enough to get the maximum response. In average, we get the maximum response at around 50 or 60 milliamperes. But since there are so many factors that will influence that, so we have, first of all, the electrodes. If they're brand new, if they stick well to the skin, the conductivity is good, I will need lower amplitude to get the maximum response. If the skin is dry, the conductivity is not so good, I will need a little bit higher intensity of stimulation. Again, body hair, how much body fat is between skin and the muscle. These are all factors that will influence when will I reach the maximum response. To be on the safe side, we start low. Usually that's around 20 milliamperes. and then I increase by 10 milliampere steps until I get 2 consecutive responses that will be exactly the same. So even if I continue with stronger stimulation, I will get the same response all over again. So when I reach that, I just keep the last measurement. If you want to be sure, from the statistical point of view, you can keep more than that with the same current, of course, and then you continue with the other muscles. So when you are, let's say, skilled to use the TMG device, it shouldn't take more than a minute to do the measurement on one muscle. That includes positioning of the electrodes, positioning of the sensor, going through the measurement protocol, and moving on to the next muscle. So you don't have to wait very long between individual stimulations, because with this short 1 millisecond long impulse, you don't generate fatigue, you don't create potentiation in the muscle. So once the movement stops, I'm not talking about the movement of the whole limb. Usually this is not present, but when the muscle belly relaxes again, everything stands still, you can measure again. And that's within 2 or 3 seconds. So what you can do is, now it will take a little bit longer because I'm stretched a little bit. I will walk front and back. Usually you have everything. I would have my computer here, but I need to display that. So that's why it will take a little bit longer. And that's it. This is how the measurement protocol looks like. And like I said, we'll try to measure 3 muscles here, 3 on the other leg, turn him around, do left and right, and that should be enough to get the general idea how the measurement looks like. If there are any questions in between, just feel free to ask, okay? Okay, extend your knee. So I'm sure that from there you can see, the outlines of the muscle belly here. So I'm trying to focus on the medial head of the quadricep here. So, okay, relax. Both electrodes are placed on the muscle belly. So one more thing that I didn't mention, the amplitude of the sensor tip is 32 millimeters. I don't know if you remember the values of displacement. It goes from maybe 1 millimeter on tibialis anterior muscle up to 15, sometimes 20 if the tonus is really, really low. So the pressure is always the same. So there are 2 things that you have to consider. First of all, you need to make a contact with the muscle. That means that you will push the sensor tip a little bit inside, so this initial pressure will be created on the muscle, and you still have to leave enough room for the sensor tip to move. So if you go about halfway in, you're in the right position. So once you do that, you are ready to do the measurement. So in the beginning, it will take a little bit longer time because you go around the subject, look from different angles, because the sensor should be about 90 degrees, so perpendicular to the skin or to the surface of the muscle. If it's 10, 15, 20 degrees in either direction, it doesn't influence the result. But if it's like 45 degrees, of course, it will influence it. But once you get enough experience, it can be quite quick.